Several patients infected with the Ebola virus were detected in Kampala, the Ugandan capital, last October. Since then, health centers have been on alert, such as this one in the city's suburbs. Dr. Mupere has just received his first suspected case of the day.
So this is the suspect who has been isolated.
This teenager has several symptoms of the deadly virus. The doctor remains careful. In just 3 months, more than 50 Ugandans succumbed to the disease, including 5 health workers.
Who are treated are also on the risk. When we see that it's positive, we isolate the family up to somewhere. We give some days or time to see whether they are developing the symptoms.
The doctor must protect himself with this essential outfit to collect a blood sample. Results will not come back for several hours, and this health center doesn't have a dedicated space for isolation.
I'm scared, of course, but as a frontliner, I do what I can. Where it's not, I cannot afford, I also give up. As I'm risking my life, I need to be supported also. While most people are running away from the situation, and then more people will die.
Uganda's health system is fragile, especially in Kampala, a city of 4 million people. These patients are wary of the epidemic.
When we come here, they give us precautions which we are supposed to follow. As you are seeing a patient nearer, sit a bit distant, let them work on the other, then you move next.
No new infections have been detected for a week. Despite the lack of resources, the country seems to be winning its fight. But for the NGO Doctors Without Borders, the situation remains worrying.
There are a lot of contact cases. It's people who could get sick, and we don't know exactly where they are and how they are doing. There is a possibility that a new outbreak could happen, so we remain cautious.
800 people are still monitored by the authorities. Uganda had not faced such an epidemic since 2000, when 200 people died from Ebola.